Welcome to our presentation on handwriting and sketch assessment in neurological diseases. Today, Dr. Adebola Adetiloye will guide us through visual examples to understand how these assessments can reveal underlying neurological conditions. Before we begin, what is graphomotor assessment and why does it matter? This clinical tool is used to evaluate the fine motor skills behind writing and drawing, offering insights into motor coordination, tremors, cognition, and executive function. Graphomotor assessments reveal crucial insights into neurological disorders. The way we write and draw is intricately linked to our brain's function. Subtle changes in handwriting or sketches can signal serious issues. In this presentation, we'll delve into how tasks like writing or drawing spirals can provide clues about conditions like Parkinson's disease. These simple assessments help clinicians diagnose and monitor disease progression. Join me as we discover how the pen and pencil can unlock neurological insights. Understanding the neuroanatomy of writing and drawing is vital. These activities involve complex coordination between the brain, nerves, and muscles, highlighting the importance of neurological health. Writing and drawing are incredible processes that engage multiple parts of our brain. The parietal lobe helps us understand space and shapes, essential for creating art. Meanwhile, the frontal lobe plans the movements needed to write or draw. The motor cortex controls our hand and fingers, making every stroke possible. Exner's area plays a crucial role in writing specifically, guiding our letters. The occipital lobe provides visual guidance, ensuring accuracy in our work. Finally, the cerebellum and basal ganglia smooth out our movements, making them coordinated. All these areas communicate seamlessly, allowing us to express ourselves through writing and drawing. Common graphomotor tasks include Archimedean spiral drawing, handwriting samples, and figure copying. These simple tasks can help detect micrographia, tremor patterns, coordination problems, and other motor issues in conditions like Parkinson's disease, essential tremor, and dystonia. Figure copying tasks assess visuospatial skills and executive function. Tasks like cube drawing and clock face copying are used to identify impairments in conditions such as dementia and stroke. Here are examples of common figure copying tasks. These visual tests help assess cognitive and motor functions, providing insights into neurological health. One classic figure is the interlocking pentagram, often used to detect constructional apraxia. Difficulty with overlapping shapes can indicate parietal lobe damage or neurodegenerative disease. In the next slides, we will look at specific examples. Micrographia, a hallmark of Parkinson's disease, is characterized by progressively smaller and cramped handwriting. This symptom reflects underlying motor control issues. The spiral test for Parkinson's disease shows tight, small spirals with regular tremor. This reduced amplitude in the Archimedes spiral is a key diagnostic feature. The spiral in Parkinson's disease is small, in contrast to what is observed in essential tremor. In essential tremor, handwriting is usually normal or large, but the tremor is rhythmic and high in amplitude. On the spiral test, you'll see wide, smooth oscillations that are consistent across the drawing. The spiral size is usually normal. This contrasts with the patterns seen in Parkinson's disease. Dystonic tremor, or writer's cramp, results in irregular and jerky handwriting. Forceful pen pressure and directional preponderance in spirals are indicative of this condition. This slide compares Archimedes spirals drawn by patients with Parkinson's disease, essential tremor, and dystonic tremor, each displaying distinct characteristics. In Parkinson's disease, the spiral is tight, small, and shows a regular low-amplitude tremor with progressively shrinking loops, reflecting micrographia and bradykinesia. In essential tremor, the spiral is larger, with smooth, high-amplitude oscillations that are rhythmic and symmetrical, often most prominent during sustained posture or action. In contrast, the spiral in dystonic tremor is irregular and asymmetric, with jerky lines and inconsistent pressure, sometimes showing a directional bias due to sustained abnormal muscle contractions and posturing. These distinct patterns help differentiate tremor types and localize underlying neural dysfunction. Cerebellar disorders often result in irregular, disorganized sketches. Handwriting may show micrographia or large handwriting with erratic pressure, reflecting coordination deficits. This slide highlights how the clock drawing test can reveal visuospatial and executive dysfunction in conditions like Alzheimer's disease and Lewy body dementia. Patients may misplace numbers, crowd them on one side, or leave them out entirely, indicating impaired spatial organization. Incorrect placement of the clock hands suggests deficits in executive functioning such as planning, sequencing, and attention. Stroke with visuospatial neglect often results in drawings confined to one side, indicating hemispatial neglect. This is commonly due to right parietal stroke or brain injury. Constructional apraxia is the inability to copy complex figures. It's identified through difficulty copying pentagons or figures like the Ray-Osterrieth complex drawing. Constructional apraxia is caused by lesions in the parietal lobes of the brain, often due to stroke, traumatic brain injury, tumors, or neurodegenerative diseases like Alzheimer's. Let's explore how modern handwriting analysis has advanced, moving beyond simple visual inspection to using digital technologies that track and evaluate the movement and dynamics of writing in real time. Did you know modern tablets can actually assess your writing speed and pressure? It's true. They can track movement patterns to help identify motor dysfunction. This is especially useful for conditions like Parkinson's disease and essential tremors. By quantifying these factors, we can better understand and manage these diseases. It's a game changer in the world of health technology. This table summarizes handwriting and sketch characteristics in various neurological diseases. Each condition presents unique features that aid in diagnosis and treatment planning. As we wrap up, let's reflect on the deeper meaning behind the movements we often take for granted. In every line drawn and every letter written, our brain tells a story. Graphomotor assessments are more than just clinical tools. They're windows into our patients' silent struggles and strengths. By paying close attention to these subtle signs, we honor the complexity of the human brain. We bring compassion into the science of diagnosis. Let's keep looking closer, because every stroke matters. Thank you for joining us. Stay tuned for our next session on the evaluation of tremors. Please like, comment, and share this video to spread awareness and knowledge.